Okay, so welcome to today's presentation on challenging limiting beliefs. They're using rational emotive behavioral therapy to promote recovery in eating disorders. My name is Molly, and I'm one of the managers of mission initiatives here at the National Eating Disorders Association. I'm so excited to welcome you all here. I'd like to just take a brief moment to talk a little bit about NEDA and the work that we do. We are a nonprofit organization working to change the way that eating disorders are understood and treated, and to empower those affected to achieve lasting well-being and recovery. Through campaigns like Eating Disorders Awareness Week and through our Campus Warriors program and NEDA Cares events, we are working to increase public understanding of these complex disorders. We also provide information and resources through the Grace Holland Cosine Resource Center, as well as through our educational programs like the Understanding Eating Disorders presentation and webinars like this one. Additionally, we promote early intervention through our screening tool, which has helped over 1 million people and is now available in both English and in Spanish. And we have also invested in groundbreaking research that is helping to develop effective treatments. If you would like to support our work or more programming like this webinar, we'd appreciate any donation. So I'll include the link later on in the chat. And now I'd like to introduce our presenter, Caitlin Cornell, the founder and director of KC Counseling, a multidisciplinary eating disorder clinic in Champaign, Illinois. She is also the founder of Nourish to Flourish, a nonprofit organization dedicated to eating disorder awareness, and is the clinical lecturer at the University of Illinois, Urbana-Champaign, where she specializes in social work. She has extensive experience in treating chronic and enduring eating disorders and is passionate about helping clients overcome cognitive barriers to recovery. If you have any questions during the presentation, please share them in the chat feature and I'll relay them to Caitlin at the end of the presentation during a period of questions and answers. Now I'd like to turn it over to Caitlin. Thank you so much for being here. Very excited to hear what you have to offer us.
Thank you, Molly. Can you still hear me okay? I moved my,
Yes.
okay, I moved my mic kind of out of the screen a little bit. Yeah, very excited to be here. I'm gonna go ahead and share my screen. Okay. Mm. Okay, so just to introduce myself, I mean, Molly did a fantastic job. Like Molly said, I have a multidisciplinary eating disorder clinic in Champaign, Illinois, which is near the University of Illinois, which I founded in 2019. Never thought my career would take me in this direction, but sometimes life is unpredictable and throws some gifts at you. So I would not be doing anything else. And also have our nonprofit where we go into schools and do screenings and awareness presentations and prevention type of work. That's been a very fun project. And also a mom, so I have to include an adorable photo of my child, of course. But other than that, I mean, Molly mostly covered everything. I am a licensed clinical social worker and certified eating disorder specialist. And so today, I'm going to introduce a tool, a very useful recovery tool that I learned in my own recovery journey. I am a firm believer that we are all recovering from something, even if we are in a good place in our relationship with food in our body. We may be recovering from people pleasing or from certain types of trauma, maybe substances. And so, yeah, this is a tool that I learned on my own recovery journey and have carried it through to the work that I do with individuals on a regular basis. So I will explain what we're going to do, and it is hopefully with this crowd interactive towards the end, but I'll sort of lay out the technique that we will be learning, and then you will get an opportunity to apply it. And so I really want you all to walk away today being able to identify some limiting beliefs that drive disordered eating or whatever behavior it is that you may be struggling with, understanding how our irrational beliefs impact our emotions and our behavior. Learn and practice this method of rational emotive behavioral therapy. Really exercise some self-compassion and flexibility rather than some perfectionist thinking, and be able to integrate these strategies into your daily life and recovery. So this is a tool, and I will say full disclosure, because I'm human, um, that I still get very activated by things as well in my day-to-day life, and this is a tool that I continue to use on a fairly regular basis. So I'm a little biased, but I think that it works. Just a little bit of background. REBT really falls under the umbrella of CBT, or cognitive behavioral therapy, developed by Albert Ellis. Many of you have probably heard of CBT or use it either in your own work or work that you're doing with a therapist. CBT is a great tool. The reason why I choose to use a more rational emotive approach is it's a lot more nuanced than CBT. CBT seems to be very straightforward and matter of fact. In what we're going to be doing today, we will be disputing some irrational beliefs, for example, but in a much more nuanced way. And I'll explain what I mean by that as we get further into the explanation. CBT is much more matter of fact in that it'll say something is simply not true. Well, this thing, there's like a 0.5% chance that this thing that you're afraid is going to happen is going to happen. So, therefore, it's not true and it's not going to happen, and we should move on with our day. At least in my experience with CBT. And this is what I like about REBT is it's a little bit more nuanced and really peels back the layers to why we're having the reaction that we're having, and to prevent us from behaving in a way that doesn't necessarily align with our values. The core idea being that it's not the event or the activating event that causes the distress, it's our beliefs about the event that shape our emotional and behavioral response. Everything that we do has everything to do with us and nothing to do with anybody else. And same thing for other individuals as well. Everyone's reacting and behaving based off of their own world perceptions and experiences and trauma and all of those things. Whatever it is, however it is that their brain has formed throughout the years. And so this is to help us gain an understanding of that and to prevent us from, again, like I said, reacting in a way that doesn't necessarily align with our values or what we want for ourselves. And I'm sure many of you have experienced at some point, I mean, that would be kind of miraculous if you haven't, where you do something and then later on you think back and you're like, why did I do that? That felt so out of control. That felt like it wasn't me. That why did I lash out like that? Why did I say that manipulative thing? Why did I do this? And it's not a comfortable place to be to look back, but this allows us to look back at something that we said or did, or some sort of reaction or behavior that we engaged in, and really sort of analyze what happened and how can we do it a little bit differently the next time. It's not meant to be a complete 180 after using this technique one or two times. So, I sort of talked about this in the objectives, but really we want to, actually, I'm just going to skip to the next slide because I think it explains it a little bit better. So we're really breaking down activating events, and I'll explain what I mean by an activating event on the next slide. But breaking down these events, identifying our immediate thoughts, and then we want to prevent an entirely emotional or limbic reaction that may not be in our best interest. And then we want to plan a new empowering way forward. In my experience using REBT versus using CBT for the purposes that we're going to talk about it today. I find REBT to be very empowering. Um, and part of that is when you're using this technique, especially if you're working with a professional, and we'll do some workshopping today, um, you're able to create a dispute or a new way of thinking that sort of rewrites the narrative around the story that you're telling yourself. And all of us are telling ourselves stories, and we're usually telling ourselves the most hurtful, painful version of the story that could possibly exist. So this sort of puts things and it sheds a different light on the story that we're telling ourselves. Um, okay, I was going to say something else, but I'm actually just going to save it for whenever we're going through the columns themselves. And if at any point you have questions, feel free to drop them in the chat if you are confused about anything. But hopefully by the end of walking through all of these columns, it will begin to make sense. So if you imagine, and actually it's at in a few slides, we will be workshopping our own activating event together, and I'll propose an activating event in my own life as well. But while I'm going through this, if you want to grab a piece of paper, um, to write down in whatever makes sense to you. I use it in a column format. But if you want to write down each of these columns, that will be helpful whenever we get to the workshop part. Okay, so the first column is going to be about, don't fill out the column yet. I'm just going to explain what each column is. Um, the first column is going to be column A, which is the activating event. This is really something where I would describe it as it produces some sort of somatic experience a lot of the time. So, activating could be your chest starts to get tight, or your face gets hot, or you clench your hands or your jaw. Or maybe you get butterflies in your stomach, or maybe you get that feeling like you're about to cry, like you have a frog in your throat. Any of those would be activating events. It evokes some sort of emotional response, and we know that emotional responses provoke a very physical response for us as well. Examples of this might be trying on clothes that don't fit us anymore. It may be accidentally eating past fullness and that feeling uncomfortable. It may be receiving an insensitive comment about your plate or your body. It may be getting broken up with by a romantic partner. It may be someone sending you a passive aggressive email or text. And it could even be something as simple as getting cut off in traffic or getting stuck in traffic. So, if you have experienced any of those, really think about the emotional response that that evokes for you and the perhaps the somatic experience that comes with that as well. And that is what we would call an activating event. The second column, B, this is where it helps to have a therapist or professional, and I'm here with you today to help you workshop this column, um, kind of break down what the actual like derivative of the belief is. So we have this activating event, we have an emotional and somatic response, and we have an automatic thought that usually comes after that. Um, I'll walk through all of these examples, but this is about belief. The belief column is about us. It is not about the other person. So the belief can't be, okay, I got cut off in traffic, and what I'm putting in column B is that driver is an idiot. You can't make it about the other person. It is solely about you and your perception of the world. So a much better fit for that example that I just gave, getting cut off in traffic, you might have the thought that the other driver is an idiot and they don't know how to drive and get them off the road and, all of these other things. But actually, what we would put in that column is that you believe that people need to drive the way that you think that they should, or people need to do what you think that they should be doing, or you know the best, the way that other people should be behaving best. It would be something to that extent. There would be, at least in my experience, there would be some element of control. I should be able to set the rules for everybody else. Everybody else should be living their life according to what I think is best. So that's where it gets a little bit tricky in this column because I think people have the tendency to say, like, oh, well, this is this person's fault or it's because they did this. But we really have to look inward, right? Because we are reacting based off of our whatever just got triggered for us. We're reacting to something that we are experiencing internally, and it just happened to get triggered by something on the outside. So, some common irrational beliefs, let's say your automatic thought, I'm including the automatic thought on this slide as well. Um, let's say the automatic thought is, I should be making treatment progress faster so my parents can go back to work. The derivative of that may be that that person feels they are a burden. Maybe they have the automatic thought that their treatment team doesn't care about them, and therefore they think, I don't matter. I should gain weight faster to make my team happy. That may turn into, I'm responsible for other people's emotional experiences. And let me know if this is confusing to anybody, because this can be difficult to really um, decipher what the actual limiting belief is here. I failed since I've gained weight may turn into I'm not good enough. And this may be different. So if I'm doing this with someone, I'm going to ask if that resonates with them. If I throw out, oh, it sounds like you might be thinking I'm not good enough. Does that feel like it sticks or does that feel like it resonates? They might say, no, it actually feels more like a burden thing. So these, how I've laid them out in this slide, these are just examples. These are not the hard and fast rules of how to derive that this particular belief can only be derived from this thought. That's not true. It's going to look different for every person. People will judge me if they know that I was at treatment. That tends to be something like I need everyone to like me, or I need to control what other people think about me, or I need people to only think positively of me. And another one, maybe my friends should reach out more. And that would be one of those people should do what I want them to do, or people should behave according to what I think is appropriate. We are really peeling back the layers on that one. And then we have the next column, which is consequences. So this is not the consequence of the first column. This is the consequence of the second column of the belief that we have. So if we believe I need other people to perceive me in a particular way, so this has nothing to do with like getting cut off in traffic or whatever it is that the activating event is. If our belief is I'm not good enough, because that's not, if we do enough of these columns or enough of these workshopping the activating events, you're probably going to end up, no matter what the event is, with the same handful of limiting beliefs that you have about yourself. So I encourage you, once we get through all of this, to really begin to utilize it on a regular basis so you can see what gets activated, what gets poked at for you anytime something external is happening. So the consequence is for the belief, not for the first column. So this would be if I feel like I'm not good enough, that may be why I engage in people pleasing behaviors. Or if I think I need people to like me, that may be why I engage in people pleasing behaviors. Feeling like you're good enough could also, or feeling like you're not good enough could also result in isolating or feeling guilty or shameful or restricting or engaging in any other sort of eating disorder behavior. It could be ruminating or spending a lot of mental energy just thinking about the thing or thinking about the event. It could be anger, yelling, blaming, shaming other people, kind of lashing out at another person. It could look like body checking or comparing. So the point of this column is to really identify what is the price that you are paying for the belief system that you hold about yourself. Feel free to let me know if that's not making sense thus far. So this column is really to point out what is the cost to you for believing the things in the second column. And usually the price is pretty high. Many other things could be in this column, like substance use, um, gambling. We could put a lot of things in this column if they apply to you. And then we get to disputing. So this is where the change actually starts to happen. We're sort of putting our thoughts on trial. This is where it's very similar to CBT, but like I said, we're using it in a much more nuanced way. So CBT might say something like that, well, we're just going to say that that's just simply not true, that you're not good enough because you're very good at math and you're very good at this other thing. So you clearly are good enough in many areas. That's not the type of thing that I would be putting in this column. And I'm also not trying to sell a patient if I'm walking through this. I'm not trying to sell them on the fact that whatever they've put down in the second column, in their beliefs column, is 100% false, because it's probably not going to happen. If someone feels like they're a burden, it's probably not going to happen that we walk through one of these like 6 column worksheets and they suddenly feel like they're not a burden anymore. That's just not realistic. I just need them to start to entertain the idea that it may not be true, that actually they may be good enough in some areas. Um, or maybe they're not a burden. Maybe they add a lot of positivity to this one relationship. I just need one example as to why it's not true. If they're further along than that, that's great. But this, what I like about this tool is it leaves a lot of room for ambivalence about the process. So someone does not have to believe that they're not a burden. They just have to entertain the idea that they may not be a burden to everyone. Hopefully that makes sense. But we may dispute by asking lots of different questions. Is this belief absolutely 100% true? Can we say without a doubt, 100%, you are definitely not good enough? Someone may say yes to that, like that it is 100% true, and that's where it helps to have a professional helping you. Um, but even if we could get that down to it's 99.5% true. Okay, let's identify what is that 0.5% that says that it's false. And we can move forward with that. We may also just ask what's the evidence for or against it. We may say, is it this or is it this? Where we would fill in those blanks is it yes, it's 100% true. You are definitely boring and no one likes you, or is it, and we might fill in the blank with something like, um, growing up, it felt like we might fill in some sort of maybe trauma that happened to them. Growing up, you were conditioned to feel like you had to be this extrovert in order to be accepted. Like that sort of depends on who that person is and what they've experienced. That's helpful to have a professional with you as well. And lastly, can I find just one piece of evidence that it's not true? So, like I said, we are just trying to make that foundational belief a little bit unstable. Like, we just want to rock the boat enough to where we can move forward into the next column. Totally okay to feel apprehensive about it. We want to start really small. Um, and even just small pieces of evidence that the belief isn't true is going to be good enough. So is it a good example? Is it factor in it as an opinion? That's a great dispute. That is an excellent dispute. Someone asked, is it a fact or is it an opinion? Okay, moving on to the next column. These would be our sort of new way of thinking about something. And this is also very nuanced. You'll probably just get tired of me saying that. Um, this is really rewriting that more empowering, compassionate, recovery aligned, rational sort of thought. So, I like to start this column, especially for people who've never used this tool before. I am learning blank, 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 blank. So, um, one example that I put in here, although I've been raised in diet culture, I am learning to embrace and accept my body as it is. I've been conditioned to feel guilty for eating blank foods, but I am working to unlearn these beliefs. I am learning to release the desire to control people and situations that I cannot control. So it's very compassionate, as you can see. Like, I am in a learning and growing process. It's not going to change overnight. I'm not going to beat myself up about this. And I am trying to unlearn these things that are in the second column. Um, there, well, actually, what I was about to say is probably better for the workshop portion too, because some of you probably have some examples where we may say, um, similar to the dispute column, like perhaps being raised in an environment, and I'm learning to forgive myself for carrying these beliefs because these were given to me. I wasn't inherently born with these beliefs about myself. So that may be another thing to put in that column as well. Okay, and then last column before we actually practice this, this sometimes not, I will say not always, but a majority of the time, whatever it is that we've experienced warrants doing something, some sort of action going forward. This is the only other column that responds directly to the first column. So moving forward is about the activating event. So we've kind of bookended it. So we say, here's the activating event. We peel back the layers. Okay, let's peek under the hood. What's really going on? Why did I react that way? Okay, yeah. Okay, I see what's wrong. Now I'm going to fix the problem. Okay, and then we shut the hood to the car. We fix the issue. And now moving forward, what are we going to do differently? Is there anything that needs to be done right now? It could be something literal. It could be, I literally need to have a conversation with somebody, or it could be something, again, more nuanced or less tangible, like I will remember what's in my control and release what is out of my control. Or I like to put actual tools in this column. Like, I will utilize bilateral stimulation to calm myself down when I'm getting really worked up, when I get caught in traffic. Um, Again, the another more tangible tool would be this. Like, I will develop an exit plan. This happens a lot around the holidays, as you can imagine, for situations that I anticipate inappropriate or insensitive comments about food or my body. So moving forward is uh, much more literal, although you could put in some of these more compassionate statements that are a lot less tangible. Okay, so I'm going to give you a couple of examples actually, and then we will walk through one together. So here's just putting this one all together. This is a pretty surface level example. Activating event being that they ate dessert at the birthday party. Maybe they ate a little bit past fullness. Their belief may be that they're not good enough. Their consequences, they felt guilt and shame, and so they skipped dinner, or they compensated in some way. They spent a lot of time and energy body checking, disputing, is it really true? Is one dessert, quote unquote, everything? Assuming that they had a thought that it was everything or they would lose everything. And here's another good dispute is, what would I say to a friend if they thought this? That's another good dispute. Is it, someone already said this, is it a fact or is it an opinion? Is it this or is it this? So lots of different ways to dispute there. I may add something in there like is it I'm bad for eating this food, or I was conditioned to feel this way from, our sociocultural norms around this type of food. And new effective way of beliefs. I'm allowed to enjoy one food. One treat doesn't undo my progress. I'm human. And moving forward, maybe in the future, I'll list in my body if I'm craving a dessert, then I will have dessert. And in that column, I would probably be even more extreme. Like, if I'm craving a dessert, I'm going to treat myself to a high quality dessert, and really like invest in myself in that way or something. So I like to fluff it and make it a little bit more empowering for the individual. But again, that is more of a surface level example. This next one, here's actually, I'm going to skip this slide only because I'm going to show you right now. This is what the worksheet, so I'll fill this one out with you all, but this is what the worksheet in columns looks like. If I'm happy to send this to Molly afterwards if you want the actual worksheet. Otherwise, right now you can just use a piece of paper. It's not necessary to use the columns. That's just how my brain likes to compute this. So here's a little bit less surface level. And this is one that came up with a patient. So a woman at church continues to make comments about how quote unquote healthy I look now. It makes me feel like I've gained too much weight. So that was very activating for this individual. Limiting belief, I'm not good enough as I am. I need others to perceive me in a certain way. I must have control over others' opinion of me, or slash what others think of me is my business. And we could probably even add more limiting beliefs onto that column. The consequences, she did end up restricting because of how this comment that this woman took and how she made about her and her beliefs that came up because of that. So feeling like she's not good enough or feeling like people need to perceive her in a certain way leads to restricting or other eating disorder behaviors. Lots of emotional energy spent spiraling about the comment. Like, I think she spent maybe 20 minutes of the session just like, what did she mean by that? I need to know what she meant by that comment. Lots of energy being spent worrying about what other people think about them. Isolating because now she feels embarrassed about her appearance, and also feeling irritated and spending time away from her family and kids, feeling sad and depressed and embarrassed and hiding out um, because of that. So this is highlighting the price that she pays for these beliefs. And to be clear, this is not meant to be a blaming sort of you're causing your own distress sort of thing. This is these beliefs were handed to us through usually through trauma or through sociocultural norms, which in and of themselves can be traumatic. So this is we're paying, what is the price that we're paying for these beliefs? And I'm going to guess the cost is just way too high, and that's why we want to dispute it, and that's why we want to move forward differently. Like the cost, that's exactly what I am saying to patients is the cost is just too high for something, for a belief that you weren't even born into the world with. This was just handed to you. Okay, the dispute column in this situation, we did is it A, you are definitely not good enough. That is true. Or is it this woman at church, she did mean well, and she probably just has no idea the impact of her statements, and that we get to choose if we're going to interpret it negatively or not. Because that woman just moved on with her day and didn't think about it anymore, probably. Meanwhile, this particular patient it took up a lot of her day. It took up many hours of many days following that. And that's what I mean by that's a very high cost. Our new way of thinking was it's easy for me to get triggered by comments about my body, but I am learning to release control over what others think of me or my appearance. I understand my appearance has been tied to my worth, and I'm working to unlearn that. And then moving forward, um, we discussed intentionally exiting situations that don't serve her. So, just a practical tool. Do you need to leave church before you run into this woman? If it really is like that distressing. Remembering her resiliency and priorities when others make comments about my body because they truly have no idea what it is that she's going through. Setting boundaries if she feels confident and comfortable enough to do so around discussions around body size. And this is maybe one of my favorite things to put in this column is not outsourcing our inner peace to and well-being to other people. So remembering that we're in control of that, and we, through these beliefs, make the choice to outsource that to somebody else. So my response to her was, this woman, um, you allowed this woman to walk away with your inner peace when we that's not the way that it should be, right? You get to keep your inner peace. We don't get Other people don't get to take that from us. We let them take it from us. So how can we make this adjustment so that way you stay in control of your inner peace, even if you hear a comment like that hurts you in some way? So this is more of those nuanced examples that I was talking about. And now I will walk through. Um, yeah, someone said, could the moving forward be simply to take it as a compliment? Absolutely. If that person is in a place that they can take it as a compliment, totally. This patient was not in a place where she could take it as a compliment. Anything alluding to her gaining weight was incredibly distressing. But yes, if someone is in a place to take it as a compliment, yes, that can absolutely be in that column. Okay, I'm going to shut off just the um, slideshow part so I can fill in this for you all. So if you have your piece of paper, and this is where I know we're sort of limited on the time that we have left, but I will walk through an example so you can see me filling it out in real time. And then if you have an example that you're filling out, I encourage you to fill it out on a piece of paper, your own activating event. And if you have difficulty coming up with something, put that in the chat. And I would love if people shared, if you feel comfortable as we go through each column, if anyone wants to share, like, this is the belief that I came up with, or if you have trouble, here was my automatic thought, but I'm not sure what belief I should derive from that. That's where it becomes much more of a workshop, right? And I'm not the end all be all. It's always going to be, does that resonate with you? Okay, so activating event for me, I was flipping through some old recordings a couple days ago, and I came across an older video of myself where I will use a body image example, where my body was different, and I immediately um, was immediately, I'm just going to say displeased. It didn't totally wreck my day, but it certainly took up brain space for sure. So this is one example. So coming across an older video, does anyone have any examples that they want to drop in the chat of their own activating event? Yeah. Oh, yeah. Weighing yourself, looking at pictures of yourself when you were younger. Yeah. Clothes not fitting, a friend making an insensitive comment. Yeah. Oh, someone said, yeah, parents taking care of their child with an eating disorder. Mm-hmm, mm-hmm, mm-hmm. Molly, they can't see each other's, right?
No, they can't.
Right. Okay. Yeah. So many people with weighing yourself. Okay, so write that down, put that in the first column. I already have a hunch as to what a lot of your limiting beliefs will be. And mine is pretty similar. So for me, if I'm being honest, my immediate thought was probably something like, oh, like I can't believe this. I can't believe people can see this video, or like embarrassment. So I am not good enough. This one, oops, if I could type, that's a big one, but actually even more so for me. Correct. You cannot see each other's comments. Um, I need others to perceive me in a particular way that is positive. I would say that's a big one for me. I'm actually going to add to this one. I'm only enough if I look a certain way. So these would be the most common ones. Okay. People are sharing. Great. Oh, so for some of the, this is where I'm gonna workshop it a little bit because a couple of you have added some. So, um, is it, Molly, is it okay? I'm not sharing names, but is it okay to share some of these? Do people
Yeah.
feel
Yeah.
comfortable with that? Okay. I'm not as worthy for friendship in a bigger body. That one, I would actually derive that to I I have to earn love, or I have to earn my place in a relationship, or I would actually even take that even further to perhaps some things about unconditional love in that situation. Because remember, these are beliefs not even necessarily directly related to this activating event. These are things that come up over and over and over again. So you could leave that as is, and you could add some of the derivatives that I just named. I can't do anything right, no matter how hard I try. That might turn into I'm incompetent. I'm not capable. That may be one. Those are the two that come to mind for me. Sorry, I was covering my mouth. Hopefully you can hear me. Can't do anything right. Need to be more disciplined. I'm lazy. I mean, this may just be not feeling good enough again, or in order to be good enough, I must look a particular way. Yeah. And someone mentioned self-worth. Self-worth is, that could be a lot of things. That could be I'm a burden. That could be I don't matter. That could be in order to matter, I have to look a particular way. Okay, for the sake of time, I will move to consequences. So, luckily, when this happened, I'm in a pretty good place in recovery. But years ago, this would have been like I would have isolated, um, definitely ED behaviors. Um, I would do this thing that I hate that I do. That this is that like the trauma piece, right? Um, I would like spend energy trying to like subtly get others to reassure me. So again, outsourcing, I've then just outsourced my inner peace to other people because I need them to tell me that I'm okay for me to be okay with myself. Um, and I wrote down one other thing. Oh, and then just ruminating over the video. Okay, and we see these are the price. This is the price that I pay for believing these things about myself. And that's not blaming, it's I clearly inherited these from society. Always struggling with self-worth. Okay. Yep. Label reading, restriction, isolation. Right, that the isolation's a big one for people. Feel free to keep dropping your consequences. I'm going to put the dispute in here again, just for sake of time. Um, so I have here, is it really that I'm not good enough? Or is it that I was conditioned to only feel good enough if I'm in a smaller body? And it's this one. And maybe someone is experiencing this and this may be one way to just get them to see that there's a small percentage that the belief that they have is not true, but they may not feel ready to believe that yet. Okay, yep, ruminating, back to consequences, feeling bad in the body, tending to eat more on these days. Afraid to go shopping, definitely. Engage in all or nothing planning. Yes. That's a good one. Totally. Um, totally something I would have done before. Immediately all or nothing. Immediately I need a plan. Mm-hmm. Is conditional or was I okay? Is that friendship is conditional or was I conditioned through upbringing that? Yes. Is it that friendship is conditional or was I conditioned through upbringing that thinness equals worthiness? Yes. Perfect. And we can take bits of that into this next column. Yeah, the someone also mentioned the working out, that they were conditioned to feel good enough only on days that they worked out. And we are the never miss a Monday, that sort of mentality that's kind of drilled into us from the fitness community. So this is where we can take the blame off of ourselves. Um, For this, I may say something as simple as I am learning to release society's expectations of my body and accept and embrace the journey it has been through. So that's where I would say that it's empowering in that way, flipping it to, well, my body's carried me through a lot. It's been through it's been through a lot. I wonder if you all have your new ways of thinking. This one's a fun one. And while you're doing that, um I am going to fill out this one. So I did utilize self-compassion because I can get down on myself as a professional. Um, but I still live in this sociocultural environment that idealizes certain body types. So it would be unrealistic for me to say that can 100% shut that out all the time. And these are the ways that our brains were programmed from a young age. So utilizing self-compassion, um, um, remain conscious of ways I may still be tied to my ED or and me specifically, I do a lot of IFS or internal family systems work. So I would put something in here like I will work with the ED parts to understand what it needs from me. But not everybody has to put something like that. This one was just specific. Okay, let's see. Give me Yes. Oh, I love this for new way of thinking. I give myself permission to define my own success and capability. Um, I am learning that not everyone understands the impacts and belief systems of those with eating disorders. I will recognize that society thinks it's okay to give unsolicited dieting advice. I can decline the advice and move on with the day. Yes, absolutely. You kind of combined E and F in that one, setting boundaries around the advice and moving on. Anyone else? Is it okay, Molly, if they keep dropping those? I know we're like,
Sure. I mean, there's a few
7 minutes.
questions coming in if we want to move on. I don't know if we,
Yeah, yeah, that is totally fine.
okay. So I see in the Q&A, someone is asking, is this appropriate for a registered dietitian to use?
Yes, I have so at my clinic, yes, I have the dietitians and the psychiatrist as well as all the therapists do a training on this. So this is like great for dietitians because it's a very tangible tool that they can use.
And someone else is asking if um, you work through this worksheet with a client in a session, do you send it home with them or do you keep a copy for your file?
I generally don't keep a copy for my file. I usually just send it home with them and make my note. What I will write down though is the limiting beliefs that continue to come up over and over and over again for them.
That's all I see in terms of questions for now. So if you want to move on and then see if anything comes up while you're finishing
Yeah.
up.
Yeah. Does anyone have any other, is anyone stuck on D, E, or F? Absolutely, this is a good skill to teach high school students. As soon as my son is old enough, I mean, he's not even 3 yet, so everything is activating to a 3-year-old. No, this is going to be a great and with high school students, they may even need some more sort of like regulation before they can actually sit down and and do this. They may need to calm down a little bit. Would I use this worksheet when I'm in distress or daily? I would both. If something distressing in particular comes up, if you feel regulated enough to sit down and think clearly enough to fill it out, I think that's a great time to do it. But I would just, yeah, I would fill it out. You could fill it out every day if you feel like you're just getting really activated all the time. Otherwise, I tend to just pull it out if there's something that like won't stop, won't leave my brain. If it's just taking up so much space and I'm just tired of it taking up space, that's when I'm gonna pull out one of these. Yeah. Do you believe in mantras or positive affirmations tied to the new way of thinking? Yes, because there are lots of things, there are lots of like mantras that we could use for new way of thinking, like, or, and even for the last column, like boundaries and balance, like I'm learning, well, that's not really a mantra, but I don't need others to be okay with me for me to be okay with me. Um, Let me think of some other ones. Yes, I'll think of some more, but yes, I think that those can be very useful for clients that resonate with those sorts of things. Yeah, great. I realize I'm saying yeah, and you all can't even see the all the things that I all the things that I say. That's probably confusing for people. Yeah, I even like little quotes, like maybe even longer than a mantra. That may be helpful for them. So, okay, I'm going to pull up just our last slide here. Final takeaways that you are not your thoughts. Your beliefs are learned. They, like I said, they were given to you through experiences, through trauma, through just life, through epigenetics. I mean, we could go really deep into that, but the point is, you weren't necessarily born into the world feeling that way about yourself, and they can be changed, although it can often be difficult to make those changes. This is a very practical tool that anyone can use at any time. You don't even need the column worksheet. You can just fill it out on a piece of paper. It's not about being perfect. It's really about digging up these limiting beliefs. And of course, you are allowed to take space. So thank you all for taking up space today, and for those of you who participated, and for having me.